Hello, and thank you for joining us for one of 3 podcasts about kidney transplant. Today, our special guest is Dr. Matthew Cooper, who's going to share his thoughts on transplant from the doctor's perspective. My name is Jerome Bailey, and I'm the Associate Director of Patient and Family Engagement with the End Stage Renal Disease National Coordinating Center. We partner with patients, healthcare professionals, and the Centers for Medicare and Medicaid Services, also known as CMS, to create and share resources that help kidney patients improve their quality of life. When a person's kidneys stop working, he or she must decide on a treatment to replace their function. The treatment choices are most often in-center hemodialysis, home hemodialysis, peritoneal dialysis, or kidney transplant. Kidney transplant is considered the best treatment option for kidney failure. Today I'm speaking to Dr. Matthew Cooper. Dr. Cooper is a professor of surgery at Georgetown University School of Medicine and the director of Kidney and Pancreas Transplantation at the MedStar Georgetown Transplant Institute. He is a pioneer in the laparoscopic donor removal of a kidney procedure and in the field of paired kidney exchange. His research focuses on removing barriers for living organ donors, and he is co-chair of the National Kidney Foundation's Transplant Task Force to reduce the rate of discarded deceased donor kidneys. Dr. Cooper, thank you for joining us.
Good morning, Jerome. Thanks for having me. This is an important topic. I'm really pleased to be here.
Well, thank you. Thank you. So our first question, when should a patient's healthcare team start the conversation about kidney transplant as an option?
When there starts to be a recognized depreciation in someone's kidney, their kidney creatinine or the glomerular filtration rate or what their kidney is doing, we usually say when patients have a GFR somewhere below 60, or they start to have chronic kidney disease stage 3, we think that it's an important time for providers to start to speak to their patients about, first off, ongoing excellent care of their medical problems to prevent progression of kidney disease, and 2, to start to think about options should they become necessary for replacement therapy, in part because we'd like for patients to have the option to choose transplant over dialysis, and the data has clearly shown that transplants in a preemptive fashion or prior to beginning dialysis have the best outcomes. And so we, as a transplant program, are very happy to see patients early and have a number of those that never go on to develop end-stage renal disease, but yet have a plan available for them if they need it. And so I think the answer is when people start to progress to CKD stage 3, GFR is less than 60, it's time to start having that conversation about kidney transplant.
Are there specific tools you use to educate patients about the transplant process?
There are a number of websites that I think are very helpful. The National Kidney Foundation, I think, has an excellent website that describes chronic kidney disease, some of the things to avoid and how to protect kidney health for people that have either a history or of chronic kidney disease or a family history of chronic kidney disease. A number of associations, including the American Association of Kidney Disease, the End Stage Renal Disease networks, also have an abundance of information that I think is purposefully put there to give patients the tools to be their own advocate, to be able to start to ask the questions that are particularly germane to their situation, and allow them to take control of their own health care. I think the greatest tool we have in our armamentarium for caring for people with known kidney disease is providing them with not only their own personal information, but information to take better care of themselves and to be able to ask the right questions. And so I think there's a lot of great data online from those organizations that can give people those skill sets to be able to care for themselves and to ask their providers the questions should particular offerings not be made to them directly.
If you were speaking to a nephrologist or a nephrology group, when is the best time to refer a patient to a transplant center? Yeah,
so there's probably two answers to that question. There are patients who clearly have decay in their kidney function. And like I said, we like to start to see patients when they have CKD4, and certainly when they have CKD5 and not on dialysis. In other words, before people have end-stage renal disease, we like to start to speak to people about options other than dialysis, and particularly focus a lot of information around opportunities with living donor transplant. The biggest challenge that we have in kidney transplant, I believe, is not really having to make the argument that transplant is better than dialysis and certainly offers people not only a greater longevity but a better quality of life, but it's the organ supply and demand problem. Currently in the United States, there's about 100,000 people waiting for kidney transplants. There's probably a significant number more who would benefit from transplant but haven't gotten access to a transplant program. But we only perform about 17,000 transplants each year. That's a combination of both living and deceased donors. And while I think there's a lot of exciting things that are currently going on to try and increase the number of deceased donors, we really still need to consider, for the appropriate individuals, those to come forward and be living donors. So if we can begin to talk to patients, like I said, when they're in CKD stage 4, CKD stage 5, about living donation to both the patients and their support system, because unfortunately not everybody is able to donate a kidney. Sometimes it requires a period of time for individuals to identify a potential living donor. And so while we evaluate the recipients at that period of time, we also look to evaluate donors if they become available at that time as well.
What about for those patients that are already on dialysis? When is the best time to refer those patients to a transplant center? Yes,
soon as possible, I guess, is the simple answer to that. The time on dialysis, is for those that have spent time or have been in a dialysis center. It's a rough lifestyle for individuals, and again, we'd like the opportunity to see as many patients as we possibly can, realizing that the indications for transplant have really changed for sure over the last 2 decades, and individuals in the past who may have been thought to be non-candidates for transplant or have absolute contraindications have changed significantly as we've learned more and more about the selective use of immunosuppression, as we've developed therapies for taking care of people with illnesses such as HIV and even hepatitis C, even people who have had cancers in the past. We've realized that the fear that we had of transplant and utilizing immunosuppression and its potential risk for the patient, that the risk is probably greater for a lot of those people to be on dialysis for longer and longer period of time. So really, anybody that's on dialysis, who either they as an individual or their providing physician on dialysis, believes them to be a candidate, we'd like to see them as soon as possible. I say it's never too late, but it certainly is, I think, valuable to see someone as soon as we possibly can. And if they're on dialysis now, that time is immediately.
How can doctors assist their patients in having a successful referral to a transplant center?
The dialysis patient, the end-stage renal disease patient, certainly most of those patients have a complex medical history. They may have had multiple admissions to the hospital, multiple surgeries, be on several medications, may perhaps a significant heart history, including even a heart surgery or stent placement. In order for a transplant program to make a safe decision about candidacy for transplant, we believe it's our responsibility, and the patient should hold us to this, that we want to review all that data firsthand, and with the expertise we have at a transplant institute, like at the program I work here at MedStar Georgetown, that we have our specialists review that information very carefully, and work to make decisions based upon our critical review of information. So helping us to gather that information, helping us to assure that new tests that are perhaps ordered and performed, that data be sent to the Transplant Institute so that we can keep active records. Means making sure that things like cancer screening per the American Cancer Society recommendations, that those tests are kept up to date at the time with which the society recommends. And I always say, not because we're looking for reasons not to transplant people, but because we want to make sure people's lives are better with transplant. And if we don't do those tests, which are designed to identify problems early before they become symptomatic so that we can treat them perhaps more safely with better results, we don't want to ignore those things and then add immunosuppression and make someone's life worse by perhaps making a cancer worse. And so probably the simple answer to that question is making sure that there's an appreciation that this is a team approach to transplant. The patient, the referring physician, the transplant team, always maintaining good documentation and communication so that we are always ready for what hopefully is the phone call that says it's time for that individual patient to receive a transplant, and us being able to say that we have all the information that says that it's a safe time to do that.
What advice would you offer to other healthcare providers when discussing kidney transplantation with their patients?
Erring on the side of patient considering them to be a candidate rather than assuming them not to be simply because they have perhaps a complex medical history or because they may be older. We are transplanting people when they're in their 70s and 80s. Now, that caveat is that the years of survival following transplant may be different, but again, ongoing data that we've collected demonstrates that those patients, again, will do better than dialysis. And so, my advice is to really think first that most people are transplant candidates rather than the reverse, and ask the transplant program either the questions that may make people concerned about their transplant candidacy rather than assuming that they are not, and or encouraging people to present for a transplant evaluation, and ask the transplant centers to do what we have committed to do, which is to evaluate people for recipient of this valuable resource in organ transplants, and with our expertise and with our collaboration in a multidisciplinary group like we have, determine whether or not, in fact, they are transplant candidates. And so I think it's, in some ways, trying to remove a little bit of the fear and the stigma that still potentially exists in the community about transplantation, and realize that it is a successful and by far the best intervention for end-stage kidney failure, and it's really to everyone's benefit to be considered as a potential transplant candidate and to try and get them referred to a transplant center as soon as possible.
Dr. Cooper, it's been a pleasure to speak with you today. We are grateful for your time and dedication to improving the quality and experience of care for all of those touched by kidney disease. Thank you.
Thank you. I appreciate everything that you're doing.
We thank you for listening to this podcast. To listen to the rest of our podcast series on transplant or for additional information on the kidney transplant process, visit the End Stage Renal Disease National Coordinating Center website at www.esrdncc.org or talk to your healthcare provider.